hospital. Do you want me to like to ask her to introduce herself, or will she just straight up go?
You can ask her.
Oh,
Sorry.
you ready?
Yep.
So, please introduce yourself.
My name is Kim Holmes. I'm a nurse here at Orange Park Medical Center. I am an ICU nurse by trade. I also have my CCRN, which is a certification in critical care, and I'm also TNCC and EMPC certified. And those are trauma-related certifications.
So the first question I want to ask you is, what have been some large emergencies at the hospital in the past few years, if there were any?
So we've done several preparations for large emergencies, but we really haven't, knock on wood, had any really like mass casualty events. We get traumas every day, multiple times during the day, usually not more than 2-3 people at a time. We've had as many as 6 people at a time and not consider that a mass casualty, but it was very straining on our resources. We're prepared for the hurricanes, and we have a whole process in place for the hurricanes, not just for staff, because you have to have enough people, but you have to have enough ancillary staff, you have to have enough security, you also have to have enough supplies. You have to remember, whenever there is a big event like that, if you lose electricity, if the roads are impassable, you have to have enough supplies available in your facility for your resource to take care of whatever might come in.
So another question I have for you is, in recent years, have you noticed a spike in disaster-related injuries at all?
No, not a spike in it really. Mostly what we get is motor vehicle accidents, and it's just a constant in Florida. I think the speed limits are a little bit high, and and people like to race, and we have some straight parts of highways where people just like to tear down them at a very high rate of speed, which leads into a lot of injuries. We still have people that refuse to wear seatbelts, which leads to catastrophic injuries. There is a larger number of people that are either overdoses or impaired by whatever else is available out there. We run different things at different times of the years. That's pretty much that.
So to your knowledge, what would someone in training have to go through to prepare for possible emergencies that you mentioned earlier?
So like a trauma type injury?
Yes.
So everybody is required, in order to become a trauma facility, there is what they call a trauma book, and you have to follow the trauma book. That's put out by the state and national guidelines. So doing that, you have to have X number of CEUs per year, per division in your hospital. The med-surg units have to have so many, the ICU units have to have so many, the trauma units have to have so many, the ER nurses have to have so many. So everybody gets that. So everybody gets some kind of trauma training. The baseline for that is the TNCC, the Trauma Core Nurse Training. EMPC is the pediatric version of that. So all of our ER personnel are required to have TNCC and EMPC. The ICU folks and post-op people, the people in the OR, they get something called TCAR, which is a trauma nurse, but it's like after the accident happens, how to care for the patient after the accident happens. So they get TCAR, and each of those is like 16 CEUs each, if not more than that. Plus everybody has to be BLS trained and ACLS trained in those areas. So there's quite a few training, plus the educators, which is what I do now, have to fulfill the requirements of the state and the national, the requirements and the expectations of our administration at our hospital.
So in your opinion, do you believe that doctors locally are prepared well enough to respond to disasters?
The ER doctors are, the intensivists are. Your general run-of-the-mill doctor has training, but will they have what supplies they need to respond to a disaster? Maybe, maybe not. Our EMS people constantly trained. Your paramedics and firefighters and stuff constantly train. So they make sure they have readiness training. I know Jacksonville even has the water training people so that they can rescue people from water should we get flooded or whatever like that as well. They have advanced training and that stuff. So yeah, our docs are prepared.
So in the past, has anything gone wrong within the hospital, and if so, what has exactly gone wrong?
I wouldn't say anything's gone wrong. There's always room for improvement, and you never know how people are going to react. Especially these days, people seem to be angrier faster, and there are more weapons around, so you have to be more cautious of things like that. So I wouldn't say that anything's really gone wrong. Our practice on mitigation for disasters is how we stay ready and why we do the practice drills so that we do stay ready. The practice drills are a pain. They really are. They take away, I mean, we have real patients that we're treating at the same time. And so it takes away time from our patients because we can't bring in extra staff because we're pretending to have some kind of event. In fact, when we have events like the Northeast Florida disaster drill, the people that are playing in that drill don't know that it's coming. Few of the administrators know, of course the play actors inside of it know because they got to get prepared and whatnot like that, but as a whole the staff does not know, the administration doesn't know what's going down. They just know that the call goes out that the disaster's going down, and then we practice what's put out in our policies.
So in the past years, in your opinion, how prepared have the doctors in this disaster drill been, or any type of other drills?
So the docs are prepared. It's a matter of making sure that that they don't take it too far. Yeah, they're prepared. They're like gun-ho for it. ER doctors are a different kind of mindset. They're always ready to go. They want to, let's get into there and get it dirty, get it down, get it dirty. So the ER docs are always prepared. We have a lot of residents, so while the residents might be frightened of the initial shock of it, the whole idea is getting the exposure for them so that they can see where they need to improve their stuff. But we use these drills, we evaluate the drills post the event so that we can look for any errors in our policy, any errors in our processes, so that we make sure that we are doing the best that we can for our community and for our patients and our staff. We want to make sure everybody's taken care of.